So we're delighted to have Dr. Sam Saleh here with us today to discuss things on behalf of King's College Aesthetic Dentistry Society. Dr. Saleh is an alumni of King's. He graduated in 2000. Since then he began to work in America and founded ORA Dentistry Spa in Beverly Hills, which is hugely acclaimed. He currently has a clinical practice in London that he comes to around once a month, and he's also a really strong proponent of modern advances in dentistry, incorporating intraoral scanning and CAD/CAM printing into his work as well. So we're delighted to have Dr. Saleh here to chat with us today.
Thank you.
Dr. Saleh, if I could begin with a little bit about yourself. When did you first become interested in aesthetic dentistry, and whilst you're at King's, what steps did you take to further enhance your education in this field?
To be honest with you, I think aesthetics and just, looking at things that are pleasing to the eye is something that I've had since childhood. So I've always looked at things in a way of, being able to appreciate like a beautiful painting or beautiful car, beauty in the face. So it's definitely something that I feel is just innately within me. When I was at King's, obviously I was cultivated in terms of how I could focus that and gear it more towards, dentistry and improving someone's smile, but kind of stepping out of just the smile and looking on how that could have an impact on the entire face. And I really feel that, once I did that, that really revolutionized the way that I looked at aesthetic dentistry and the magnitude of the impact that it could potentially have in someone's face.
So you graduated from King's, but then you moved to America, and I believe that while you were there, you even went so far as to lecture for a while at UCLA. Mm-hmm. I know that I've got a lot of peers that have expressed interest in doing dentistry abroad, and particularly in America. I was wondering what lay behind your decision to go to America?
Particularly California was kind of a second home for me as a child. So my mother's side of the family lived in California, so we were always out there on summer holidays. So that gave me an insight into the lifestyle and the culture. So when I found an opportunity where I was able to go and kind of try it out and see if I liked to work there, I did. And I initially went in there thinking that I will stay there for a year turned into 2, and what is it, like it's 15 years later and I'm still there.
Yeah, and I'm sure that your work and the nature of your work has changed over those 15 years, but is there a single common theme that you find most satisfying about your work?
The interaction between the patients. That for me is the most fulfilling part of my job. It's getting to know new people, creating those relationships, building a trust, and then of course being the visual person that I am, seeing the transformation that I can bring about in them.
And I think certainly from our perspective as students, we've always noticed there to be the specialty of aesthetic or cosmetic dentistry being far more large and greater tradition in the United States than traditionally it was in the UK. I think the American Association of Cosmetic Dentistry was founded in 1984, and the equivalent organisation, the BACD, only in 2003. However, saying that, we've certainly noticed that in the last couple of years there's a huge growth in the demand from patients who want cosmetic and aesthetic outcomes. Is that something that you've noticed?
I think we have social media to thank for that, and I think the advent of the selfie, we're just under the scrutiny more. I think we're all our own little celebrities because we take so many photographs, and then once you take a photograph, that's when you're analyzing yourself and really looking at all the nuances. So patients will come to me telling me what they want because they've spent so much time in front of the camera on their phones and things like that, where they've already pinpointed what it is about their smile that they don't like, or what it is that they want to enhance. So it is the new generation, it's a culture. I don't think it's something that we're going to turn back from. So yes, I think for our industry, for all of dentistry, cosmetic dentistry, and just general dentistry, these are exciting times.
And I think that raises a really interesting question as well about patient expectations. Patient expectations is something that we're lectured to about extensively at university, and especially for somebody like yourself who has a truly global patient base. How do you find, or do you notice any differences in what is defined as the perfect smile in patients from different countries across the globe?
I think it is. I think it's a very individual sense that the patient will have, and I think what's very important, and that's why I pride myself in creating and building those relationships, is really having good communication between your patient. Because what you have to realize is that aesthetics is very subjective. What you may find to be beautiful might not be what somebody else will find as beautiful. So us as the providers, the job that we do, yes, we can give our opinion. Of course, we have to guide our patients in terms of what's structurally correct, what's functionally correct. But when it comes to aesthetics, it has to be a joint effort, and you have to take on what your patient wants. And if you go into it with that open mind and you have that open communication, then you'll always have successful outcomes.
And I think increasingly now we're talking more and more about the role that technology can play in dentistry. We're always hearing terms like digital smile design and similar terms. I know that you incorporate intraoral scanning and CAD/CAM into your practice, but what do you feel the single most important technological advancement has been that's impacted upon your practice and dentistry more generally?
For me, I would say photography plays a huge role, because the better I can capture an image of my patient before we get started, the better I can really analyze them, really getting to know every nuance of what's existing. Because once you have a really good understanding of what you have, that's when you can create something from there. But if you didn't capture the right image, or if you didn't have enough information starting off about who this patient is and what they're presenting you with, that's where I feel there's a potential for miscommunication.
Where do you see technology in dentistry going in the next 10, 15 years and the potential implications that could have?
I mean, these days it seems like we're all going to get replaced by robots, so there'll probably be a robot, doing it now. I'm just joking. I definitely feel that technology will aid us, and it will perhaps bring a certain standard in dentistry, because it will potentially remove some of the error factors that can come by, clinicians of different standards and different educational backgrounds. So in that respect, I think it could be very good. But I do always feel that there'll always be a place for somebody with a keen aesthetic eye, because that's something that's very hard to completely take on by a computer, or completely take on by a robot, or something outside of something that you innately have within you.
If I can just very briefly touch upon your own clinical practice, what treatments do you find yourself providing most of, and what's the largest thing that patients come in and ask you for?
I mean, the predominant treatment that we do at the office is, cosmetically based treatments, which are involving restorations such as porcelain veneers, porcelain crowns, implants for missing teeth, or porcelain bridges. So that really makes up the bulk of the majority of the treatments that we do at my office.
I think another term that we often hear really bounded around as students is the terms of like preserving nature and achieving facial harmony. I think we've all got quite a basic understanding of what that is, but you're obviously somebody that has a much deeper understanding of that. How important do you think achieving facial harmony with regards to someone's smile is to the patient and the overall outcome, and how did you develop your ability to appreciate this?
I think facial harmony is hugely important. The smile can, if done correctly, it can bring the nose into proportion with the face, for example, or align, a poorly aligned jaw, or if there's a very short lower third of the face, you can actually increase the vertical dimension. So there's a lot that you can bring to the face. It's all really held together by a very a deep understanding of how everything comes together, and once you have a good handle on that, there's a lot that can be done in terms of facial aesthetic dentistry, which is really where I see this all going, and that's really what I think cosmetic dentists should look more at if they want to get the kind of results that patients are now requesting.
Yeah, definitely. I think even just from our reading as well about aesthetic dentistry, one of the things that shocked us just as students is how much of a difference to somebody's overall face just the changing of a smile can make. You're obviously a very well-established dentist, both nationally and internationally. Where do you see your practice and yourself being in 10 years, 15 years?
I hope that I'll, always be able to expand, always push barriers. It makes me very happy and very proud to know that I offer somewhat of a role model to some people out there, and that makes me really happy. So I hope that I'll always be able to be a positive factor in that respect. And it makes me also very happy that I'm able to help patients, from all walks of life, from all across the world. So it's a great platform for me to meet, a really amazing array of patients.
And just to finish off, Dr. Saleh, if you could offer any advice to your 21-year-old self, or to any dental students like Karen and I, who are in a similar position and have ambitions to go and pursue a career in aesthetic or cosmetic dentistry, what would that advice be?
It would definitely be to be patient. I think when you're young, you want everything and you wanted it yesterday, and in doing so, one is more inclined to cut corners and rush and make potentially hasty decisions. This is a profession that doesn't happen overnight. I've been doing this a very long time, and I certainly didn't start, my career, the way that it is now. So it takes time, and I feel that if you have that mentality to be patient, then you'll always do the best that you possibly can, and that's how you'll be able to achieve something wonderful. Because if every one of your stepping stones was done to the best of your ability, then I think you have the potential of being truly magnificent.
Thank you very much for your time, Dr. Saleh.
Of course.
Cheers. Thank you.